I started having knee pain probably like my early 30s. I started having knee pain. It wasn't as bad, but through time it got worse. Well, I've been here for 10 years, but where I used to live at on Renner, it was like probably like 30-something steps, and I lived there for 20-something years. One Saturday, I went grocery shopping, and by the time I got them groceries upstairs and I dropped them in the kitchen floor, I just started crying. I said, I gotta get out of here, because the steps was killing me. A few years back when I was younger and working, I fell initially. And when I got to the hospital, I had surgery here on the back of my leg. And ever since I had that one surgery, I've never walked properly again. But I continued to work more and more, and it took more wear on my knees till like 3 or 4 years after the first fall, I wasn't really able to walk anymore. It limited me. I couldn't provide for my family anymore in the way we were accustomed to. I worked. And because of the knee pain and other events that happened in my life, I started gaining a lot of weight, which made this situation worse. Went worse. I went to 389 pounds. I still had a young kid, 9 years old at home. He was accustomed to, he wanted Nikes, I bought it for him. Then I had to start explaining to him, I can't do these things when I don't have the money. Since the womb, we've always been together. We take care of each other. When we was little, from circumstances, she loved on me and I would love on her. Like, I would sit in her lap and she would treat me like her baby. And then when I got finished, she would say, okay, it's my turn. And then I would love her as if I was her mother, because we needed that. And we still love on each other like that on this day. So when we turned 60, I said, sister, I'm getting my knee replaced. I don't care if you're doing it or not. She said, well, I'm not getting it, but I'll find somebody for you. She's the smart one. I'm the boss, but she's very smart. I went through the Google, and I Googled up orthopedic doctors and Dr. Jankowski. I sat for 2 weeks writing down names of different doctors and reading their reviews over and over and over. Not one person had a bad thing to say about it. They were saying how attentive she was, the staff were, how the recovery stage, how she was there every step of the way, making sure they was okay. I couldn't find a reason not to say yes to. I said, sister, this is the one for, I'm gonna go with you.
So Yvonne and Yvette both came to me with very similar wear patterns, which happens to be the most common pattern of wear we see in osteoarthritis, meaning the inside of your knees wear out prior to the outside and you get a little bit of that bow-legged deformity. They had attempted treatment with oral medications like anti-inflammatories. They had attempted physical therapy. And when none of those options provide any sustained relief and you are unable to perform your normal activities of daily living, the end of the road is surgery.
And then we get there, Dr. Jankowski said, you two? I was like, no. So Dr. Jankowski said, no, I'm gonna do both of y'all. I'm gonna tag team you. One, I'm gonna do her, then I'm gonna do you. They were concerned because we are identical twins that we wouldn't be able to get it done on the same day. And then that's when me and her was like, no, we want to do it together because we do everything together.
Put grease in her wig.
Shut up. My relationship with my twin sister is everything to me. But she a little boss. She try to run me, but she know I'm the boss. I'm the oldest. We're 20 minutes apart. And she do what I tell her to do. And she probably sitting back to acting like she don't, but she do. Trust me, or she'll answer to me. Yes.
Their request was that it be done on the same day because they are a support system for each other. And, if I could quote them, they do everything together. Is that common? Certainly not. It's not every day that you see twins that you're treating together, and certainly not necessarily operating on the same day.
So then they decided that we would wear different pajamas, and then they had marks, like I got tattoos here and I have my name. She had something, so that's what they had on the chart in order to tell us apart. Me and my sister, we did the recovery together. And it was important because I had somebody who was knowing what I was going through. And on some days I would feel really good. And I would call her and she would be crying. And I would say, oh sister, it's okay. You okay, you okay. I have somebody that's gonna support you through it because it's a lot. And the end of it comes, look at these legs. You can't miss this. They not bow-legged no more, they straight. I could walk, I could play with my grandkids. I go to my grandson's football games. I could walk all the way around the thing. I used to be like, I'm not walking, I'm gonna sit in the car. I went to the hospital to say my last goodbyes to my husband, and I walked. It was long ways down. Then my daughter had death visual, and she was parked like almost a Bergen Street. I walked, and she was like, "Oh wow, Ma." She said, "Ma, I'm so proud of you that you was able to do that." I was like, "Yeah." I said, "I wish Ad was here to see me doing, because he never got to see me, you know, really walk like this, because he was in a nursing home." We just do everything together. And as it has it, we both needed this knee replacement. And as it has it, we found Dr. Jankowski, who is, I don't even know the word, supercalifragilisticexpialidocious. That's the word from my childhood, that she has given me back some of my ability to run and dance like a child again. And I could never thank her enough.
They're wonderful sisters, and they always bring a smile to my face whenever I see them in the office. It makes me very happy that they both achieved the same degree of success, and so that's all I'm looking for, and I'm hoping that they're satisfied with their outcomes.
I'm down to 230 pounds. I'm trying to get to 200. I haven't been to the beach in the water in over 10 years. I want to walk down, and I had nobody lower me into the thing like some kind of shark or something. I don't know. It's embarrassing. I want to go to the beach, run in the water with I have 9 grandchildren, push water on them, play with them, chase them. I want to do all those. I want to go to the grocery store, pick up my own groceries off the shelves, go shopping in the clothes store. I'm not worried about, are you wheelchair accessible, because I can walk again. And I'm so appreciative of that. I'm hot. Whew. Get you a cold water when we get in the house. Don't give me $1 for it, though. I ain't giving you no dollar. It sure is.